Hey guys, welcome back to No More Cavities. Today we will be discussing fissure sealants. So what are fissure and what are sealants? Fissure. Fissure is a cleft present between two cusps. If this is a cusp and this is a cusp, when they join together they form a valley, and this valley is known as cleft or fissure. And what are sealant? The name is suggests to seal. And what are we sealing? We are sealing these fissure. Why are we sealing these fissure? Because these fissure provide shelter. To whom? To bacteria. To bacteria, resulting in caries. So, what are fissure? Fissure are cleft present between two adjacent cusps, and we seal these fissure by the help of fissure sealants. Why we are sealing? Because these fissure provide shelter to bacteria. So there are different type of fissure sealants present. The most commonly is used a resin based fissure known as bisigma. The sealants can be photo initiated, it means they are activated by light, and autopolymerizing. What are autopolymerizing? Autopolymerizing means they will be self-cured by a chemical reaction. So, the sealants can be either photo-initiated or autopolymerized. They can also be filled or unfilled. Filled means they will have filler, filled and unfilled. Filled means they will have filler. And what filler do? Filler increase their wear resistance. The sealants can also be tinted or opaque. What is the advantages of being tinted? If we add any kind of color in the sealant, this will differentiate it from the normal tooth. So what will happen when we are removing the sealant, we will be able to differentiate between the tooth and the sealant.
The fissure sealing technique. The first step is tooth preparation, in which we will perform prophylaxis. The second step is etching of the prepared surface. We will etch the tooth surface for 20 to 30 seconds with 37% phosphoric acid. The third step is cleaning and drying of the surface. The fourth step is application of the resin sealant, and the fifth step is light curing of the sealant. In this whole process, we have to maintain the isolation.
We also use GIC as fissure sealant. Why? Because it is less technique sensitive. And it is mostly used for temporary placement during tooth eruption. GIC is mostly used for temporary placement during tooth eruption. It is also used as a temporary placement when there is no adequate isolation possible, in patient having anxiety, and in non-cooperative patient. But the disadvantage of GIC is that it have poor retention.
How the glass ionomer sealants differentiate from the normal sealants. In glass ionomer sealants, we do not etch the surface, we just clean the surface and use conditioner. Which conditioner? 20% polyacrylic acid. And then we run the glass ionomer into fissures, and we protect the material during initial settings. And after applying glass ionomer, we apply unfilled resin, petroleum jelly or fluoride varnish to protect the material.
So the question arises that what kind of the patient need fissure and sealants. The first is special needs. What we will do, we will seal all the occlusal surfaces of permanent teeth. If a child is having extensive caries in primary teeth, what we will do, we will seal all the permanent molars, as they will erupt. And if a child is having caries free primary dentition, what we will do, we will not seal the permanent molars. So now the question arises, which teeth need fissure and sealants? So first is the occlusal surface of the permanent molar. Occlusal surface of the molars, cingulum pit, cingulum pit of the incisors, upper incisors, then buccal pit of lower molar, and parietal pit of upper molars. And as soon as the tooth start erupting into the oral cavity, and a permanent molar having caries, if only one molar have caries, then we will seal all first permanent molars. But if more than one permanent molars are involved in caries, then we will seal all first and second molars. So occlusal surfaces of the molars, cingulum pit of upper incisors, buccal pit and parietal pit. As soon as the tooth start erupting into the oral cavity, caries involving only one first molar, then we will seal all the first molars. But caries involving all the first molars, then we will seal all the first and second molars. This was all about fissure and sealants. Thanks for watching.